So, should you refer? Step 8. If you're unsure of the diagnosis, if the patient's young or atypical, if the signs or symptoms are not typical, if they have psychotic or severe behavioural disturbance, if there's complex comorbidities, and the rules for cholinesterase inhibitors are that you need a specialist confirmation of diagnosis, that would be another indication. Alzheimer's disease, are there drugs for the treatment? These are all symptomatic treatments. They're not cures. They don't stop the disease progressing. They delay the progression of symptoms in many patients. There are 4 drugs approved. 3 of them are cholinesterase inhibitors. Aricept, or donepezil, is now off patent, and there are about 6 generics out there when I had a look yesterday. Galantamine, or Reminil, is also off patent, and there are generics out as well. The rules changed this month for the PBS, and so I prepared these slides about 2 months ago, so I'll tell you the difference. Exelon, or rivastigmine, changed the formulation to a patch, so their patent doesn't run out till about 2017. Ibixil memantine is approved for moderate to severe Alzheimer's disease. The benefits are modest. By the way, by conflict of interest, I have been on the advisory board for all these drugs. They're symptomatic treatments, they're not cures, and it's important to tell patients and their families that so they don't have unrealistic expectations. About 2 out of 3, roughly, this is what I tell my patients, either maintain where they were or improve temporarily. And this little graph is showing some temporary improvement and then decline. And so people stay about 9 to 12 months ahead of where they'd be without the drug symptomatically. Doesn't mean you stop it after a year, because if you do, then they decline. They rejoin the baseline of where they'd be without the drug. Contraindications are active peptic ulcer. Most people are being treated, and I haven't run into trouble with that. I'm more worried about bradyarrhythmias, because the anticholinergic can slow heart conduction down. And so if I'm in doubt, I'll send off to a cardiologist for approval before starting the cholinesterase inhibitor. Asthma is a theoretical contraindication. I've not run into trouble with any patients if they've had a previous adverse event. What are the adverse effects? Mainly GI, sleep disturbance, nightmares, muscle cramps, dizziness. I always give my patients the dose in the morning, after breakfast. So with a meal, I start off on half a tablet, on half a dose. So if it's donepezil, it'll be 5 milligrams, going up to 10 milligrams after 1 or 2 months. The PBS rules are you need confirmation of diagnosis by a specialist, a mini-mental state score of at least 10, and if the mini-mental state score was above 24, you need an ADAS-Cog. Now, I'm not sure, this may have changed about the ADAS-Cogs part, because up until this month, subsidisation was for the first 6 months, and beyond that, the patient had to show at least a 2-point improvement on the mini-mental state. Or if they had a high mini-mental state, you had to do an ADAS-Cog, which is a much more detailed test, takes about half an hour. You need a special kit, so it's a referral to a psychologist who does these, and needed a 4-point improvement. Well, the initial prescription was by a specialist, or it can be by you after specialist confirmation of the diagnosis. Doesn't mean the specialist has to see the patient. This was important for rural areas where doctors couldn't get ready access to specialists. Continuation, the rules have changed since I made this slide. If you and the patient and family agree there's been a significant improvement, that's all you have to show. And you now can do streamlining for continued medication after the initial assessment. So you get 6 months subsidised, and beyond 6 months, it can be done by anybody. There are special cases where you don't have to go through this whole thing, but that's probably going to be no longer relevant now that we have this streamlining. Any differences between the cholinesterase inhibitors? Not really, not in effect. There are some differences chemically, There may be some differences in side effects. And if somebody hasn't responded to one, you can change to another. The dosage, with Aricept, start with 5 milligrams, go up to 10 after 1 or 2 months. Remdil, 8 milligrams to 16. The patch, 5 to 10.